Hello, my name is Nadarajan Sudhakaran. I'm a pediatric surgeon based in Kuala Lumpur. My specialty is in pediatric laparoscopic surgery. There are lots of ways in which we get referred patients. The first of which would be the antenatal diagnosis. These kind of conditions are found before the child is born during the period of the pregnancy. Those stages, sometimes I get to see the patients. Often the ones that are identified after birth would be things like when the child is vomiting, or when the child is unable to pass open bowels, or something that they find once the child is born, some abnormalities, they are externally visible. Those are the first instances. The other instances where there are symptoms, the commonest would be hernia. So you see a swelling in the groin. The other would be an emergency such as appendicitis. So cervical atresia, you can't swallow. You have to reconstruct within the first few days of life. Dural atresia, you can't feed. You have to do it within the first few days of life. Other conditions like choledochal cyst, which is abnormality of the common bowel duct, can wait for a few months for the child to grow before we do the reconstructive surgery. I also deal with urology, pediatric urology, which is anything abnormal within the urinary tract, from the kidneys, bladders, and the urethra, the male urethra usually, which is the hypospadias. So the other conditions that I come across, the emergency conditions, appendicitis or gallstones, or if there's any problems with the testes twisted, something called torsion of testes. Those are emergency conditions that an older child will present to the emergency department and needs urgent surgery. Keyhole surgery, we call it keyhole. Basically, it's a small hole that we make to introduce a camera either into the tummy or the chest. And basically, with the camera in the chest or abdominal cavity, we introduce two other instruments for the right and left hand for the surgeons. So the camera is held by an assistant, and the image that they see inside is projected to a screen, so everyone can see. The assistant as well as the surgeon sees an image on the big screen. Now we use 4K, which is really good definition. You can see every little tiny blood vessels. Then the surgeon, using two tiny instruments, the ones that I use are 3 millimeters. Basically, we make tiny little dots of incision without cutting much of the muscle. By doing that, we reduce pain, which is because of the cuts. We reduce disruption in the inside, so scarring in the inside, and long-term scarring. So long-term scarring you see in the outside. And the recovery is fast because there's less pain, and only a tiny area that needs to recover from the cuts. So if you do a standard operation, for example, for an appendicectomy, I will make a small cut in the belly button, and then two other small cuts on these areas here, and they recover very fast. If you do an appendicectomy as an open procedure, you make a cut at least 2 centimeters on the right side, just above the appendix, and that you have to cut the skin, the fat, the muscle, and then go in to get the appendix. Imagine those layers need to recover. With the laparoscopic method, it's a pinprick like, and the instruments are 3 millimeters introduced in, and then it's just snap shut without cutting the muscle, which is amazing because the muscle doesn't have to recover because you didn't cut it. You just spread the fibers apart, and they recover very fast. Firstly, we introduce the topic when we meet in the clinic. We will talk about what the condition is and what the options are in terms of surgery. And by the time they go to surgery, it's the decision made to do the surgery. And we'll explain to them about how the start is going to be, how we allow parents to go to the operating theatre with the child. So they go to sleep with the parents around, not too scared. And then the operation itself, we've done lots of pediatric laparoscopic surgery. So the journey for that surgical period is pretty pleasant, and then go up to the ward. When they wake up, they see their parents, and then when they are more aware, because we don't disrupt anything in the inside, they're able to drink or feed fairly soon. So for simple procedures where you don't involve the intestine, they can almost feed immediately. For something that we involve the intestine, where there's joints in the intestine, we may rest the intestine for 24 hours. And because we rest the intestine for 24 hours, We give them additional nutrition by means of intravenous fluid, and then usually by the next day we are able to feed. So the whole process is not too stressful, because children want to feel less pain. They want to do what they normally do, play and run around. So with any process, even for example a hernia operation, they are running around next day. For a more complex procedure, we do a reconstructive procedure in the abdomen. By 2 days they are running around. I've done procedures where we take apart the lung lobe. In fact, they're climbing their cots within the next day. So it is a process where they recover fast, and basically allows the child to go back to their normal activities very soon. There are quite a number of interesting cases. So the one that brings to mind is a 9-year-old girl who had appendicitis, which was not a very severe appendicitis. She came in very upset with appendicitis, and we needed to do surgery because there's no other options. So I introduced the topic of laparoscopic surgery, and she was very tearful. And she said she has to attend a athletic meet the following week. She was an athlete in school and she was representing a school. I said, you need surgery, you can't avoid it. So it was quite straightforward surgery. We did laparoscopic appendicectomy. The next day she went home. And it was interesting because she managed to go for the competition, and she won 4 gold medals, and she was so happy. And then she sent me all the photos of her getting all these gold medals on her neck. So if you do little dots on the tummy, the recovery is so much faster. You don't feel like as if you've done a surgery, so therefore they can function normally.